Acute coronary syndrome, ACS, is a critical condition characterized by sudden, reduced blood flow to the heart, leading to severe chest pain, heart attacks, and other life-threatening complications. Understanding ACS is essential for early diagnosis and effective treatment. This guide will explore the causes, symptoms, diagnostic methods, and treatment options for ACS, providing valuable insights into managing this urgent medical condition and improving patient outcomes. Acute coronary syndrome, ACS, is a term used to describe a group of conditions that involve sudden, reduced blood flow to the heart. This includes heart attacks and unstable angina. A heart attack, also known as a myocardial infarction, occurs when the lack of blood flow leads to cell death, damaging or destroying heart tissue. On the other hand, unstable angina means that blood flow to the heart is decreased, but not enough to kill heart cells. However, this reduced flow can still increase the risk of a heart attack. ACS often causes severe chest pain or discomfort, making it a medical emergency that requires immediate diagnosis and treatment. The main goals of treatment are to improve blood flow, manage complications, and prevent future issues. Common symptoms of acute coronary syndrome usually come on suddenly and include chest pain or discomfort, often described as aching, pressure, tightness, or burning, known as angina. Pain that starts in the chest and spreads to other areas such as the shoulders, arms, upper belly, back, neck, or jaw. Nausea or vomiting, indigestion, shortness of breath, also called dyspnea. Sudden heavy sweating, a racing heartbeat, feeling lightheaded or dizzy, fainting, unusual fatigue. While chest pain is the most common symptom, it can vary significantly depending on age, sex, and other health conditions. Women, older adults, and people with diabetes are more likely to experience symptoms without chest pain. If you suspect acute coronary syndrome, it is crucial to seek emergency medical help immediately, as chest pain can be a sign of severe, life-threatening conditions. Do not attempt to drive yourself to the hospital. Call emergency services for prompt assistance. Acute coronary syndrome, ACS, usually happens because of fatty deposits called plaque building up on the walls of the blood vessels that deliver blood, oxygen, and nutrients to the heart muscles. These blood vessels are known as coronary arteries. When a plaque deposit ruptures or splits, it can cause a blood clot to form, which blocks blood flow to the heart muscles. If the supply of oxygen to the heart cells is too low, the cells can die, leading to damage of the heart muscle tissue, known as a heart attack. Even if there is no cell death, the reduced oxygen supply still causes the heart muscles to function improperly, which can be temporary or permanent. If ACS doesn't lead to cell death, it is called unstable angina. Unstable angina is a warning sign that a heart attack may occur soon and should be taken very seriously. The risk factors for ACS are similar to those for other heart diseases and include aging. The risk of ACS increases as you get older. High blood pressure. This can damage your arteries and make them more prone to plaque buildup. High blood cholesterol. High levels of LDL cholesterol can lead to plaque formation in the arteries. Smoking. Tobacco use damages blood vessels and speeds up plaque buildup. Lack of physical activity. Inactivity contributes to several heart disease risk factors, including high blood pressure and obesity. Unhealthy diet. Diets high in saturated fats, trans fats, and cholesterol can raise blood cholesterol levels. Obesity or being overweight. Excess weight increases the burden on your heart and contributes to other risk factors like high blood pressure and diabetes. Diabetes. This condition increases your risk of ACS by damaging your blood vessels. Personal or family history of chest pain, heart attacks, or strokes. If you or your family members have a history of heart disease, your risk is higher. History of high blood pressure, preeclampsia, or diabetes during pregnancy, and early menopause. These factors can increase the long-term risk of heart disease in women. COVID-19 infection. The virus can cause inflammation and damage to the heart and blood vessels, increasing the risk of ACS. Understanding these risk factors can help in managing and potentially reducing the risk of developing acute coronary syndrome. Acute coronary syndrome, ACS, requires immediate hospital care. Tests are performed to check the heart and identify the cause. Some tests may be done while your healthcare team asks about your symptoms and medical history. Common tests for ACS include electrocardiogram, ECG or EKG. This quick test measures the heart's electrical activity using sensors attached to the chest and sometimes the arms or legs. Abnormal heartbeats or patterns in the electrical signals can indicate a blockage in the heart. The test might be repeated several times. Blood tests. After a heart attack, certain heart proteins leak into the blood. Blood tests can detect these proteins to confirm heart damage. Your symptoms and test results help your healthcare team diagnose ACS and classify it as a heart attack or unstable angina. Additional tests may be conducted to gather more information, rule out other causes, and determine the best treatment approach. Coronary angiogram. This test reveals blockages in the heart arteries. A catheter is inserted into a blood vessel, usually in the groin or wrist, and guided to the heart. Dye is injected through the catheter, and X-rays track the dye's movement through the arteries. The catheter can also be used for treatment. Echocardiogram. This test uses sound waves to create images of the heart, showing blood flow through the heart and valves, and helps determine if the heart is pumping correctly. Myocardial perfusion imaging. This test shows blood flow through the heart muscle. A small amount of radioactive substance is injected via IV, and a specialized camera captures images of the substance as it travels through the heart, highlighting areas with poor blood flow or damage. Computerized tomography, CT, angiogram. This powerful X-ray test creates images of the heart and its blood vessels, examining the arteries that supply blood to the heart. Stress test. This test evaluates how well your heart works during exercise, typically involving walking on a treadmill or riding a stationary bike while monitoring the heart. If you can't exercise, medication may be used to simulate exercise. This test is only done when you have no ACS symptoms or other life-threatening heart conditions at rest. Additional tests might be performed during the stress test to assess heart function. These tests provide crucial information to help manage and treat acute coronary syndrome effectively. The immediate goals of treating acute coronary syndrome are to relieve pain and distress, improve blood flow, restore heart function as quickly and fully as possible. Long-term treatment aims to help the heart function better, manage risk factors, and lower the risk of future heart attacks. Treatment can include medications and surgical procedures. Depending on your diagnosis, the following medicines may be used. Clot busters. These drugs, also known as thrombolytics, help break up blood clots blocking arteries. Nitroglycerin. This medication temporarily widens blood vessels to improve blood flow. Antiplatelet drugs. These prevent blood clots from forming and include aspirin, Plavix, and prasugrel. Beta blockers. These help relax the heart muscle and slow the heart rate, decreasing demand on the heart and lowering blood pressure. Examples include metoprolol, Lopressor, Toprol XL, and Nadolol, Corguard. Angiotensin converting enzyme, ACE, inhibitors. These widen blood vessels and improve blood flow, helping the heart work better. Examples include lisinopril, Zestril, and benazepril, Lotensin. Angiotensin receptor blockers, ARBs. These help control blood pressure and include irbesartan, Avapro, and losartan, Cozar. Statins. These lower cholesterol in the blood and stabilize fatty deposits to make them less likely to rupture and form clots. Statins include atorvastatin, Lipitor, and simvastatin, Zocor, Flolipid. Other cholesterol-lowering medications, such as ezetimibe, Zetia. To restore blood flow to the heart, your healthcare provider may recommend surgery and other procedures. Angioplasty and stenting. This procedure uses a thin tube and tiny balloon to open clogged arteries. A surgeon inserts the tube into a blood vessel, usually in the groin or wrist, and guides it to the narrowed heart artery. A wire with a deflated balloon on the tip goes through the tube. The balloon is inflated to widen the artery, then deflated and removed. A small mesh tube, called a stent, is usually placed in the artery to keep it open. Coronary artery bypass surgery. In this major surgery, a healthy blood vessel from the chest or leg is used to create a new path for blood to flow to the heart. The surgeon attaches the ends of this graft below the blocked artery, bypassing the blockage. These treatments are designed to address the immediate threats of ACS and to improve long-term heart health. In conclusion, acute coronary syndrome, ACS, is a serious condition caused by sudden, reduced blood flow to the heart, leading to severe chest pain, heart attacks, and other life-threatening complications. Understanding ACS is essential for early diagnosis and effective treatment. This guide has explored the causes, symptoms, diagnostic methods, and treatment options for ACS. providing valuable insights into managing this urgent medical condition and improving patient outcomes. By understanding the risk factors and maintaining a heart-healthy lifestyle, individuals can significantly reduce their chances of developing ACS. Remember, if you suspect you or someone else is experiencing symptoms of ACS, seek emergency medical attention immediately. Prompt intervention can make a significant difference in the outcome and overall heart health. Please click on the next video for more Live Good info. Thank you very much.